How to quarantine yourself. The thought of going into quarantine may sound scary, but it's a simple precaution to protect yourself and others from contagious disease. Method 1. Protecting yourself with social distancing. Stay at least 6 feet away from obviously sick people. Many contagious diseases spread when people spend time around affected people, even if they don't actually have physical contact. This can happen when an infected person coughs or sneezes and people around them breathe in droplets of saliva or mucus from their nose or mouth. If you are around someone with symptoms of illness, like sneezing or coughing, avoid touching them and try to maintain a distance of at least 6 feet at all times. Wash your hands frequently when you are in public areas. Washing your hands is one of the easiest and most effective ways to protect yourself and others from the spread of disease. If you are in a public space or another area where you know you might be exposed to an illness, wash your hands after with soap and running water. Wash your hands for at least 20 seconds and make sure to wash your wrists between your fingers and the backs of your hands. It's especially important to wash your hands after going to the bathroom, after touching high contact surfaces such as doorknobs, railings, and light switches, and before handling food or touching your face. According to the CDC, warm and cold water are equally effective at washing away germs and viruses. That's more important that you use soap and wash for at least 20 seconds. If your skin is sensitive, using cold water can help prevent dryness and irritation. If you don't have access to soap and water, clean your hands with an alcohol-based hand sanitizer. Keep your hands away from your face as much as possible. Many viruses and germs enter the body through the mucous membranes in your eyes, nose, and mouth. To prevent these, avoid touching your face as much as possible, since your hand may have come into contact with a contaminated surface. If you have to touch your face, wash your hands before and after with soap and warm water. If possible, use a tissue if you need to wipe, rub, scratch any part of your face. Throw the tissue away when you are done. Cover your mouth and nose if you cough or sneeze. Even if you don't think you are sick, it's important to protect others in your community and set a good example by practicing proper hygiene when you cough and sneeze. Cover your mouth and nose with a tissue, then immediately throw the tissue away. Wash your hands and use hand sanitizer when you're done. If you don't have a tissue or don't have time to grab one, cough or sneeze into your bent elbow instead of your hand. This will help prevent you from spreading viruses or germs when you touch things with your hands. Avoid crowded areas if you are at high risk or if local health officials recommend it. In some cases, local health authorities may cancel large events or advise that people limit their time in public spaces in order to prevent the spread of disease. You may also need to limit your exposure to crowds and public areas if you are particularly vulnerable to infection. If you are not sure whether it's a good idea to go out in public, ask your doctor for advice.